What does cystic fibrosis genetic testing from blood tell you? Imagine a simple blood test holding the key to understanding whether someone has cystic fibrosis or carries the gene that could pass it on. When a blood sample is taken for cystic fibrosis genetic testing, it looks at the DNA inside the blood cells. The main goal is to find mutations in the CFTR gene, which is responsible for causing cystic fibrosis. This gene controls a protein that helps regulate salt and water movement in and out of cells. When mutations happen, this process gets disrupted, leading to thick, sticky mucus building up in organs like the lungs and pancreas. This test can tell if a person has two mutated copies of the CFTR gene, which confirms a diagnosis of cystic fibrosis. It is especially useful if someone shows symptoms or if newborn screening was positive. The test can also identify carriers, people who have only one mutated copy of the gene. Carriers usually do not have symptoms but can pass the gene to their children. Knowing carrier status is important for family planning because if both parents are carriers, there is a 1 in 4 chance with each pregnancy that their child could have cystic fibrosis. Genetic testing from blood also helps guide treatment decisions. Some therapies are designed to target specific CFTR mutations, so knowing the exact mutation can help doctors choose the best approach. Additionally, the test can be used before birth or when planning a family to assess the risk of passing cystic fibrosis to a future child, especially if both parents are known carriers. Most tests focus on the most common CFTR mutations, but because there are over 1,000 mutations, a negative result does not completely rule out carrier status or cystic fibrosis. Rare mutations might not be detected, so genetic counseling is recommended to interpret the results accurately and understand what they mean for health and family planning. It's important to remember that genetic testing from blood is mainly diagnostic and predictive. It does not monitor the ongoing health of someone with cystic fibrosis. For managing the disease, doctors relying on clinical assessments, sweat chloride tests, lung function tests, and other evaluations. In summary, cystic fibrosis genetic testing from blood reveals whether someone has mutations in the CFTR gene that can cause or carry cystic fibrosis. It confirms diagnosis, identifies carriers, and helps guide treatment and family planning decisions. Always consult healthcare professionals for interpretation of results and personalized advice, as each person's situation can be unique.